Hi, Corey DeBoer. My name is Dr. Olson. I'm going to be your physical therapist today, and I was reading in a chart, and it looks like you're experiencing some low back pain. Is that correct? All right, so what I'd like to do today is some soft tissue interventions that'll address the muscles in your back. Is that something that you're okay with?
Yep.
All right, and in order to do that, I will ask if you could remove your shirt and your shoes and lay down on your stomach on the table. Are you okay with those as well?
Yes.
All right, and would you like a drape?
No, thank you.
Okay. So at this point, if you wanted a drape, I could provide one. He did say no, so I'm gonna let him just go ahead and remove his shirt and shoes and lay down on the table. So I'm gonna take this one away for now. So what I'm looking for patient positioning is I'm gonna use the pillows to help position his back. As you see right now with just the one pillow, there's still quite a bit of lordosis in his back, which I don't want. I want to minimize that, relax it as much as possible. So what I am going to do is, that's good there, I'm going to fold this pillow in half and put it under your abdomen. There we go. So if you can see, that takes away a little bit more of that lordosis, and the back is nice and relaxed right here. We also have a good cervical position for his neck to help him stay relaxed throughout these techniques as well. The other things I want you to take note of is that even though he's tall, I have him positioned fully on the bed with his feet not hanging off. I do have a pillow, lift your legs up for me a little bit, under his shins to keep him comfortable. I have the pillows under his abdomen in order to position the back correctly. And I have a towel rolled up under his forehead, and that can be in this position or in a U position as well. But what we want you to do is use the towel roll to position the head and not the faceplate in the center of the bed. That way, you can have your patient scooted over on the table as far over closest to your side as possible, where they're comfortable still and their arm is still able to be supported. That way, it will help your own body mechanics as far as where the patient is positioned on the table. Okay. So from here, I'm going to use a towel as a drape. So what I want to do to expose the full length of the muscles that run down the back is they run and attach down to the level of S2. So I want to expose the tissues to that level. Is it okay if I tuck this towel into your shorts and pull them down about 1 or 2 inches?
Yes.
Okay. So I'm going to just do one small roll, tucking that towel into his shorts, and I'm going to pull them down just a little bit. What I'm looking for is that you can palpate the PSIS on the back and move your thumbs down about 1 or 2 finger breaths so that the towel is actually low enough for you to begin your stroke at the level of S2. Okay, so that is how you're gonna get introduce yourself and get your patient set up on the table to begin these strokes.
1, 2.